Hi, everyone. Welcome to our Thursday seminar for IRP. This is the last seminar of our fall semester, and we are very excited to be hearing from Carolyn Barnes. She's an assistant professor at the Sanford School at Duke. I want to remind everyone that I'm sure this needs no reminding, but we do not have seminars again until January 21st. So look for those announcements for next semester. In the meantime, we saved the best for last. So we are delighted to be hearing from Carolyn Barnes. She's going to be talking to us about the politics of poverty and social policy in the rural South. And I, for one, am super excited to hear her talk. So she has asked that we sort of postpone questions until the end. So I'm going to encourage you, as I always do, to use the chat to ask questions in real time. But we're going to hold off on having me read them to her or ask them, or having you ask them to her until the end. So, but go ahead and you can, as they occur to you, please put those questions in chat and we'll get her to talk about those questions or answer those questions at the end. So Carolyn, I'm going to go ahead and turn it over to you.
Oh, great. Thank you so much, Catherine, for the invitation, and Dana for your patience with me in organizing this talk. And I'm Carolyn. I'm an assistant professor of public policy and political science at Duke. And I study how policies are designed and implemented and accessed by vulnerable populations. So I'm going to do a shameless plug right quick. I just had a book come out earlier this year called State of Empowerment, Low-Income Families in the New Welfare State, where I used the case of school-age childcare to demonstrate how new trends in policy design can empower low-income parents to participate in civic and political engagement. That was a really fun book to write. It's an ethnography of after-school programs, so it involved a lot of hanging out with 10-year-olds and reading books to kindergartners and attending parent meetings and doing a bunch of community work. It's also a positive spin on what's usually a pretty negative turn in social policy. So it adds nuance to the prevailing narrative that social policies targeting low-income families are punitive and demobilizing by demonstrating the conditions under which these kinds of policies can be empowering. So if you're interested, I encourage you to check it out. It's available through open access at your library or through the University of Michigan Press's website. So I put the little link there. But I'm not going to talk about that book today. I'm going to talk through a new book project for which I'm rounding out data collection and getting into deeper analysis. So this book is called It's Who You Know, The Politics of Poverty and Social Policy in the Rural South. So for some let me not get ahead of myself. For some background, I am a native North Carolinian. I grew up in rural Northeast North Carolina, and I was super excited to return home after years of being in the very cold Midwest. And I started this project 5 years ago. In between classes and over the summer, I would visit these rural county health departments and social service offices where I interviewed WIC workers, SNAP workers, and everybody in between. In the first question I'd ask, I'd say, tell me a little bit about yourself. How long have you lived here? And then I would ask them to describe how their communities had changed over time and how their communities shaped the way they approach their work. And what I heard was so surprising. So instead of hearing pat answers about local community events or the good old days, folks repeatedly recounted stories about power and oppression. And they clarified for me a rigid social order that kept the haves on top and disadvantaged everybody else. And they also repeatedly used the term, it's who you know, when describing the social order, hence the title of the book. So instead of hearing a typical street level bureaucracy story of too many cases and not enough time, it became very, very clear that workers viewed a white entrenched power structure as shaping and in many ways undermining their capacity to deliver services. So the purpose of today's talk is to walk you through a story about how the welfare state becomes a tool for white elites to maintain a social order and reinforce racial disparities and poverty. Now, I want to be clear, this is a work in progress. So I'm going to present to you a broader theoretical framework that I'm developing from the data I've collected. I welcome your feedback. Okay. So I want to draw your attention to the persistent issue of rural poverty in the South. So the numbers that are up right now reflect the average poverty rate by region and metropolitan status. So in the Northeast and Midwest, rural and urban poverty are about the same. The gap grows when you get to the Western region, where the rural poverty rate is 16.2% and the urban poverty rate is about 13.5%. And when we get to the South, the gap between urban and rural poverty increases even more. So 20.5% of the population in rural communities are in poverty in comparison to 14.4% of urban residents. So rural poverty is definitely a problem in the South. Now, this graph breaks down poverty by race and metropolitan status. Rural poverty is higher than urban poverty for all racial groups, but rural poverty among racial minorities dwarfs urban poverty for those groups. So over 30% of African Americans and Native Americans in rural communities live in poverty. 23.8% of Latinos live in poverty in rural communities, while the white rural poverty rate is anywhere between 13 to 14%. So it's really these racial differences in poverty that's driving, I believe that's driving some of the rural poverty we see in the South. So as many of you know, 60% of African Americans live in the South, and rural Southern communities have become new destinations for Hispanic and Latinx immigrants. So again, the poverty rate we see in the rural South is largely driven by the high poverty rates among racial minorities. Now, these patterns in rural poverty are not new. They've been the topic of a bunch of research done by sociologists and economists. And rural sociologists tend to point to these features of rural communities that contribute to high poverty rates. So one feature would be rigid stratification. So there is this very rigid social order where there's not a lot of moving between strata. There's limited social mobility. There are insular social networks where economic opportunities don't depend on weak ties, but strong ties between your family and your neighbors. And family reputation really means a lot in terms of access to economic opportunities. And everybody knows everybody, for better or for worse, in rural communities. Sociologists and economists also highlight the economic decline that a lot of rural communities have experienced due to economic restructuring that started in the 80s. Globalization and technology have led to the decline of manufacturing and extractive industries. And because there aren't good paying jobs in rural communities, we get a lot of talented youth that leave rural communities. So not only are there less economic opportunities, but rural communities are often graying communities too. So you have older folks that are living in rural communities. And then finally, sociologists have pointed to the role of powerful families that are controlling resources in rural communities. Now, this depends on the region. It could be tourism and hospitality in some regions. It could be agriculture. In the case of North Carolina, it's agriculture, the extractive industry, or manufacturing. So we have some studies that try to explain why we see these persistent patterns in rural poverty and racial disparity in rural poverty, but we don't have many studies that situate welfare bureaucracies within this problem. So there aren't studies that examine how these unique features of rural Southern communities shape policy implementation to add to the problem or reinforce these racial disparities. So the two sort of central questions of the book are, how do the distinct features of rural communities shape how public welfare agencies function in the rural South? And how do these agencies alleviate or contribute to social and economic stratification? So I have selected North Carolina. The reason why North Carolina makes a great case to answer these questions is, one, it's one of the top 5 states that has the highest concentration of African Americans. Almost a quarter of North Carolina's population are African Americans. Poverty has not fallen to pre-recession levels in North Carolina. So these numbers that I have here are from 2018, which are better times, certainly, than what we're experiencing now. But North Carolina's poverty has sort of continued to outpace the national poverty rate. And the patterns within this poverty rate show wide racial disparities, and that most of this poverty is concentrated in rural counties. A unique feature about North Carolina that makes it a great case to study these questions is this decentralized social policy implementation. So North Carolina is one of 10 states that's devolved administrative authority to county level governments, the administrative authority over social policy delivery to county level governments. And what that means is that counties have a lot of discretion on what assistance programs like TANF, this cash assistance program, what it looks like on the ground. It also means that counties are responsible for a portion of the administrative costs. So they have to raise money to cover the administrative budgets of their local Department of Social Services. And then perhaps what's most telling and interesting about North Carolina as a case to explore these broader research questions are the vestiges of this landed gentry that continues to dominate county government and economic development. Now that sounds like a really loaded question. And sometimes I read that statement, I think, wow, that's a really big loaded statement and a little bit of a conspiracy theory, but it is indeed true. So one of the unique things about North Carolina, if you're riding around, we call it down east here, and you stop at any particular county, they can identify particular families that were slaveholding families that own most of the land and property in the county, and they can identify their influence in county government and economic government. And I'll show you that in a second when we get to the quotes. So there's still this presence of this landed gentry that continues to control communities. My methods, it's a mix of a bunch of stuff. So it's organizational and community ethnography at first. COVID has since changed that. I've selected 3 counties, and I've been in these counties over the course of 5 years. I started with participant observations in local social service agencies and community events. Thus far, I've completed with a team 94 worker interviews, 141 program beneficiary interviews, and 30 community stakeholder interviews. And that includes community leaders like pastors and the leaders of community-based organizations, in addition to public officials like county commissioners and local elected officials. So I'm combining that rich qualitative work with some historical documents and analysis and administrative data that captures the performance of social service agencies across counties. So here's a snapshot of the counties. I have changed their names to de-identify them and the participants in the study. So we have Granite and Cabes County. Those are the 2 rural counties. And then we have Fenner County, which is a metropolitan center. Granite County has about 40,000 folks. Cabes County has 56,000 and Fenner County has 900,000 residents. All 3 counties have substantial African-American population, over 20%. But I want to draw your attention to the poverty rates by county and race. So as you can see, the numbers really reflect the national numbers, where we have African-American, Native American, and Hispanic or Latino poverty rates dwarfing white poverty rates. So in the case of African-American, the African-American poverty rate, the poverty rate in Granite and Cabes are more than double than the white poverty rate. If for Native Americans and Hispanics, in the case of Cabes County, the poverty rate is quadruple that of the white poverty rate. So we have these wide disparities in poverty, wide racial disparities in poverty across these counties. So I'm adopting an interpretive method where I am using a combination of inductive and deductive analysis to inform data collection and data analysis. So I'm coming to data collection and I'm coming to data analysis with a couple of theories in mind. The social stratification theory that points to the role of elites in accumulating political power and economic resources. The street level bureaucracy theory, which emphasizes emphasizes the role of work conditions in compromising bureaucrats' capacity to deliver services, and the role of bureaucrats' sort of social identities in the decisions that they make with clients and the decisions they make on cases. And then the administrative burden literature, which highlights the different challenges that citizens face when they're trying to access and maintain benefits, challenges that can lead to economic hardship. So I'm not coming to data collection or analysis without any theories in mind, but the inductive portion of this project involves allowing sort of emergent themes to bubble up from the data and seeing how this fits or how this complements or extends pieces of these theories. And the interpretive method is very much an iterative process where I'm kind of going back and forth between the data and ideas, and you are a part of my process. I am coming to you with ideas and would love, again, to get your feedback. So here's the social order of the rural counties I've examined. So at the top, there is a white landed elite. They own a significant portion of land. They own businesses in the community. They also exert political influence. And by that, I mean they are often county officials in some capacity or local elected officials. Then you have a white middle class. And beneath that, you have a Black working class that are usually well-to-do families. So Black community leaders, the families of Black community leaders. And then you have rural poor whites, and then racial minorities that are experiencing poverty. And here's the snapshot of this theory, okay? So it looks like a bunch of arrows and boxes, but I promise you I'm going somewhere with this. So this book is designed to sort of demonstrate how the Department of Social Services, or DSS, ends up reinforcing that social order that I showed you. So landed elites control economic opportunities in the community while simultaneously controlling the budget constraints of DSS. DSS ends up offering employment to the middle class while buoying the low-wage service industry through revenue to local retailers, grocery stores, and so on and so forth. And then DSS then offers public assistance to supplement the low wages of the rural poor. Okay. So that's the emergent framework here. And in the next slide, I'm going to demonstrate the power of the landed elite. So this is a Medicaid worker discussing how the landed elite control the community. This is a Medicaid worker from Cades County, not Cades County, from Granite County, excuse me. So when asked to describe her community, she says, the ones who have always thrived continue to thrive, and the ones who have always struggled continue to struggle. Okay, so indicating that there are the haves and the have-nots. You have certain families who have been in Millsville, that's the county seat, and those were also the families that were plantation owners. So she's identifying that they owned slaves, they owned land. They're also the families that had money back then, and they just continued, they helped their own. Old money controls what comes in and what doesn't come in. So that's it. That will hold the county back from growing. So she's identified who's in control, who's in power, the white landed elite. They've derived their wealth and power from slaveholding, and they continue to control what happens in the county. They decide what comes in, and she's referring to businesses, and what stays out. And they're holding back the county from growing. Here's another example from Cades County, which is the other rural county. She too is explaining the almost total control of this white landed elite on the community. This is an African-American woman speaking. Old money, like got it. They got it. And they say, you're only going to shop here. You're only going to do this specifically here. And you're only going to deal with certain people. So they kind of like run the stuff. They were really running the town. Okay. So landed elites are running these rural communities. They're exerting economic and political power in these rural communities. Okay. So now that I've demonstrated that landed elite are in control, I'm going to point to some specific examples of how they control economic opportunities. Okay. So here's another worker from Granite County. She says, it's not a lot of educated people here because of the fact that there's no jobs here. We've had 7 plants that closed down. I mean, half the people barely have a high school education. There's just no reason for people to live here. So she's describing the economic decline that's characteristic of a lot of rural communities. So manufacturing jobs have left the community. And then she goes on to say, it's not a lot of room for growth. Our county commissioners and city council and all of that stuff, they're still very old fashioned. They have an old way of thinking. It took forever for us to get Lowe's because they didn't want to upset the guy who done wood in the town because he's one of the money makers of this town. Okay? So again, identifying who's in power, how they've contributed to poor economic growth in the county, how they're controlling economic opportunities in the county. Here's another member of the Granite County community. She says, there are no jobs here. The only thing here is it's a lot of family-owned businesses by white people. So they employ their family members. So if you're an outsider to try to get in, if you don't look like them, you're not getting a job. You're not getting a job unless it's like fast food. The chances are slim to none unless you know someone. Little Caesars, McDonald's, yeah, you can get a job like that, but you're not going to get a job that can support you to live independently. Those kinds of jobs are not for Black people. So again, white, powerful families who own businesses, who, and she doesn't allude to this in the quote, but discusses it in other portions of the interview, own land, who own resources, they're controlling economic opportunities to the detriment of African Americans. They're excluding African Americans from economic opportunities. Okay. So you might say, this makes sense for economic development, but how does this connect to the Department of Social Services? Well, I'm glad you asked. So again, as I mentioned earlier, North Carolina has a state-led, county-run program. The federal government shares the costs of delivering means-tested programs like SNAP and Medicaid and the child care subsidy. And North Carolina has chosen to pass those costs on to counties. So the federal government covers, depending on the program, about 50% of the administrative costs, and North Carolina has decided to pass those costs, the other half of those costs, onto counties. So counties have to raise funds to cover the administrative costs of these means-tested programs. They literally control the size of DSS. So these local white elites are not only controlling the economic development of the county, they're controlling the county board of commissioners, who also serve on DSS boards, and they determine the DSS budget and tax rates. So when these white elites resist tax raises, they're resisting revenue that could contribute to the administrative budget of DSS. Okay? They don't want to raise revenue for social service delivery in these counties. So here's an example from Albert, the director of DSS in Granite County. He says, they will not change the taxing value. The commissioners won't. You know, they have to vote on it. If they just do for 1 cent, well, what's that going to cost? But I believe it's those who own 300 plus acres, 600 acres, and all of this stuff. It would affect them a whole lot. That's a lot of money in there. So yeah, you cannot continue to operate without increasing the tax, but they just won't. One of the commissioners, Commissioner Smith, I think he is a family farm, and I think that's kind of one of the influencers. So Albert is acknowledging that he needs more money to run the agency. He needs to be able to hire more workers to deliver these social services, but he can't because the county commissioners have constrained the budget. So what happens in a lot of counties in North Carolina, whether it's urban or rural, there tends to be a tug of war between the agency, the county manager, and the county commissioners. So the DSS director puts together an annual budget and presents it to the county manager. The commissioners review it and vote on it. And then there's this negotiation back and forth between the director and the county government. And for Albert, he's been negotiating for years for more workers that would improve social service delivery, and he can't get them to budge, in part because these landed elite have a vested interest in keeping taxes low. Here's a county worker from Cabes County that points to another way this control negatively impacts the workforce at DSS. So she says, they have stunted the growth of Wendell. That's the county seat in Cabes. Wendell doesn't like to change, so old money won't allow change. You'd be surprised who owns what and the mentality of how things are done. This agency, take this agency. How many places do you know get paid once a month in this era? Not very many. How many places do you know go so long without a cost of living increase? And it's hard to recruit people because you have young people that have debt when they come out of school. So money motivates you to where you want to work and how long you're going to stay there. And they don't mind jumping ship if money talks. Okay, I haven't been here that long. What if I invested? I'm gone. So she's looking at how the control of these landed elite and constraining the budget deters talented workers from coming to rural counties and staying. So what happens is you'll have a lot of workers that might start off at DSS in a particular county, but they'll move to a neighboring county or an urban center where they can get paid more. Because again, this county-led system gives county governments discretion on salary levels and how many positions they're going to have at DSS. So this tight rein and this control over DSS discourages high quality workforce, well-trained professional workforce. Okay. So I've demonstrated how the landed elite control economic opportunities. I've demonstrated how the landed elite can control DSS. Now I'm going to demonstrate to you how DSS works with, is situated within this to create economic opportunities both ways. So this is Albert again describing a conversation he had with a commissioner about DSS being a necessary evil in the sense that it ends up supporting the low wage economy. I had a conversation with a former commissioner and he said this to my face. He says, you know, Albert, DSS is a necessary evil. And I just kind of looked at him, but I was like, well, damn, what does that mean? We do about 10 million a year in food stamps. Well, if you're on food stamps, more than likely you're not going to Sam's or Costco's in the next county over to get your food. You're going to do something here locally. So we're putting at least $10 million into the local economy, which is, we have 2 Food Lions and Walmart and a Super Walmart, even IGA, little community stores. Later on in the interview, he shared that the county brings in $70 million, or the DSS brings in $70 million into the county through Medicaid. So the white elite view DSS as a necessary evil, in part because it buoys this low wage economy. And the irony is that DSS is also filling in the gaps, as I mentioned earlier, in low wages, as sort of supplementing the low wages of folks who are working at Food Lion and Walmart and these small community stores. Okay. So it's a necessary evil in that it employs the middle class elite. So as I mentioned earlier, one of the explanations for the rise of rural poverty is the decline of the manufacturing industry. So without a good manufacturing job in counties, you end up raising the profile and the prestige of government work. So a caseworker position at this agency in Granite County is actually a pretty plum job, and people really try their best to get into the agency because there aren't good paying manufacturing jobs anymore in the county. This particular county, there was a textile mill that closed in 2006. So you had the closure of that mill in 2006, in addition to the economic recession from 2008 to 2011. So the county never really fully recovered. And this has made DSS employment super competitive. So this is an agency supervisor explaining this in greater detail. In this community, in this county, if you're not working at the power plant, the school system, or any other type, this is kind of what everyone wants to go to. It's DSS. So it's hard to get in here. People are looking for work, and they're looking not just for work, but stable work. So DSS is not going anywhere. When the economy tanks, we're at our busiest. Okay, so DSS is an attractive employment opportunity. It's very hard to get into the agency. Okay. That also means that people who work at DSS aren't driven by some public service motivation or some altruistic desire to serve the general public. They're thinking about, like she said, stability, and they're also thinking about benefits. So this is another agency supervisor explaining this in greater detail. She says, it's a paycheck when she's describing her workers and their motivation. And then they think about state retirement or government retirement. I mean, I hear all those types of things, but not really. I love my job. I can't wait to get to work. But it's like, well, this is a job. It pays my bills. I know if I retire, I have county government and state government retirement. Okay. So I've demonstrated the economic control. I've demonstrated the control of landed elite over DSS and the purse strings of the agency, and how these two things go hand in hand with economic opportunities for the middle class and the rural poor. Now I'm going to speak to the consequences of this framework. Like, what does this mean? What's the so what? How does this impact families? So by employing the middle class as a tool for employing the middle class and maintaining that strata, the landed elite are actually burdening the poor. So as I mentioned before, because of scarce employment, DSS workers gain entree into the agency through their family and social networks. So scarce employment opportunities raise the prestige of DSS employment. And given the way that rural communities work, workers gain access to these jobs through their insular networks, through who they know. But this means that the workforce is not necessarily well-trained, professional, or motivated to provide high quality services, okay? So what we see happen are failures in agency performance. So there are all these benchmarks that agencies have to meet when they're delivering services, whether it's timeliness, error rates, what have you. And if they don't meet those benchmarks, they run the risk of falling into corrective action, where the state has to come in and conduct audits or run programs, and these audits end up draining county resources. So we see this pattern in rural communities in North Carolina, that there's a lot of instances of corrective action and poor performance on these benchmarks because the workforce isn't well trained. And the qualifications for getting a job at DSS isn't your education and training background, it's who you know, it's your family reputation and those insular networks. So here's an example of that. This is a worker that's talking about the low qualifications of some individuals who've gotten positions. A lot of times it seems like certain people are already picked to go in that position beforehand. It's just floored some of us totally, because some people don't have any experience at all, and they automatically get certain positions, and they've never even had any training in it for that job before. And I just don't see how that can happen. But that's happened a number of times here. It's because of who they know and who they're related to. And they could have known them, they could have grown up here, known them for a long time, okay? So this worker is describing how people access jobs in the agency. It's based on who they know, not their professional experience and their training. Okay. What does this mean for the rural poor? They're largely excluded from economic opportunity, as I showed you earlier in the presentation. There are jobs that African Americans can't get, that racial minorities can't get due to the role of those insular social networks. The rural poor also experience administrative burden, so stigmatizing interactions with workers, given the social divide between the middle class elite and the rural poor. They might experience high compliance costs because folks that are working at this agency aren't especially well skilled in interpreting complicated policies and delivering policy. So they end up resubmitting paperwork because of workers' mistakes or poor case management. And then discontinuity in services. So disadvantaged families are experiencing delays in benefits, if benefits at all. I had one woman I talked to who had applied for Medicaid when she found out she was pregnant with her son. 2 years later, had never heard back from her caseworker and was never able to access Medicaid because of incompetence at the agency. And all of this discontinuity in services and this administrative burden leads to greater hardship for disadvantaged families in these communities. And ultimately, it's sort of maintaining this social order. So you have the white landed elite that have controlled economic opportunity for everyone in the county. That's raised the profile of DSS employment. So in light of fewer manufacturing jobs and an unwillingness to diversify the county in terms of economic opportunities, the white landed elite have raised the profile of DSS employment now that in such a way that now access to that employment depends on those insular social networks. And DSS is supporting low-wage employment, which some members of the Black working class, rural poor whites, and racial minorities have access to. And in the process, it's also providing this tenuous public assistance to the most vulnerable families. So here are the key takeaways from the book project, and kind of reiterating what I just said on the slide, but landed elites are shaping social policy implementation through the way that they control job opportunities, which influences the demand for public assistance programs and shapes the demand for DSS employment. And then they also control DSS by determining the budget of the agency and ultimately the working conditions of bureaucrats. And DSS maintains social order by providing employment opportunities to the middle and bottom strata when the landed elite are reluctant to do so. So because there isn't a will to economically diversify in efforts to sort of retain that control over the community, DSS ends up directly and indirectly providing employment for the middle and the bottom strata. DSS infuses revenue into the local economy by supporting the retail and service industry, and poor policy implementation keeps the rural poor in economic hardship. Okay. So the theoretical and policy implications of this book, this project, I think it opens up the black box of local political ideology and local political culture, which is sort of a term used to explain variation in welfare spending, denials, and TANF sanctioning patterns. So there's been a lot of work on looking at, why are outcomes poorer in the South? Why do we see these variation? Why do we see all this variation in the South when it comes to the generosity of welfare benefits? Why are policy, especially in the case of TANF, policy guidelines so stringent? Why do we see these sanctioning patterns in TANF? And they usually say it's because of local political ideology. We got like a conservative state government or a conservative county government coupled with sort of this concentration of African-American families or concentration of Latinx families that's creating sort of an incentive structure to divest from the social welfare state. So they say that, and this is usually in quantitative studies, researchers say that, but I think I'm pointing to some community level processes that constitute what local political culture or local political ideology means. So I'm identifying the histories, the families, and the interests that drive this variation. Theoretically, I'm hoping to build a theory that describes this. In terms of policy, I always tell the stakeholders that I engage over this work is that we really need to centralize administrative funds for service delivery in North Carolina. Now, whether or not the General Assembly will ever do that, whether or not there's the political will to do that in the General Assembly is another conversation altogether. But if we shifted cost sharing to where the state picked up part of the bill or part of or most of the bill, we could eliminate some of the control that county governments have over the size of welfare bureaucracies in the community. And then centralizing discretion over DSS salaries and qualifications as well. If we raise the qualifications, required a state minimum qualification, and in addition, raised salaries, got that out of the control of county governments, we'd probably see better performance across counties in North Carolina. So my next steps are finishing community and client interviews. So I have some county commissioners that I need to talk to and additional community leaders that I need to talk to. That has been disrupted by COVID-19. My data collection was about, rural white power structures, and now it's become about rural white power structures and, agencies' response to COVID-19 and how people are faring given this tragic pandemic and the economic consequences of this pandemic. So I'm still doing this work and still trying to tease out the role of the elite in communities. So I'm hoping to deepen analysis. Right now, I'm really interested in triangulating these perspectives. So pulling on historical documents, administrative data, just different pieces of information that can help sort of corroborate some of the claims that are made in the interviews. I understand that these are perspectives and perspectives are powerful. So even if there isn't this continuity in political leadership or continuity in economic control, there's power in the perspective that there is, that people's perceptions of reality is still equally as powerful. And those stories get passed down generationally. So that's where I'm at right now, and I'll stop here. I'm hoping to round out data collection and deepen some analysis, and I would love your feedback on framing. Any suggestions that you could provide would be great. Thanks.
Thank you. That was incredible. I want to open it up for folks to type in questions into the chat. Oh, and Sarah Halpern-Meekin raised her hand. I always like to hear from Sarah. So I'm going to unmute her when I find her on my list. All right, get ready, Sarah, it's coming. Okay, Sarah, you're allowed to talk.
Hi, Carolyn, thank you so much for that talk. It was really fascinating, and I'm looking forward to learning more as you do. One thing that I was wondering about how you thought about this is how the political engagement sort of overlays on this, because it seemed to be an echo in some of what you were talking about, right? Like who gets elected to these commissioner seats and things like that. And so I was hoping you could, I don't know if that's been part of what you've heard come up, but I was just sort of hearing echoes of this through not just these economic opportunities, but the electoral results and things like that too. Thank you.
That's a really good point. Figuring out, is there historically has there been high levels of voter suppression in these counties for local elections? Looking at voter turnout by race for local elections would be really interesting. Thank you.
Other questions or folks who have comments? I was wondering if you could talk a little bit about some of the, what's the word I'm looking for? Some of the challenges in doing these interviews. So I was just thinking about, like, I was thinking about how, I've done interviews myself, but within organizations, hearing them describe, I'm just curious about how difficult some of these conversations must have been, or if these perspectives are just really clear and people don't mind saying like, oh no, this is how it is down here, or what,
Yeah, that's, I think it's been, that's a couple of things. So I use my identity as a, African-American woman from North Carolina, from a rural community in North Carolina, to build rapport with people. So sometimes it's sort of like a commiserating. So let me tell you how things go in this community. I'm sure you've experienced this in your hometown. Sometimes I think, honestly, I've noticed that people have not been listened to, so they're ready to tell you what they think is really important, especially if they're stressed. And in the case of, these departments of social services, if they're stressed and they're under pressure to get their jobs right, and they want to tell you as a third party, what they think is wrong, the conversations almost sound matter of fact. Like, these questions weren't leading. Just ask them,
Yeah.
hey, what's going on in your community? Well, let me tell you, So they're difficult conversations to have. And I think the way that I present the work, and even how I write it up, I think it undersells the consequences of this stuff. Like, for example, there have been African American kids in these communities that are excluded from a whole host of public services, like recreation services and things like that, because these county commissioners don't want Black kids to play with white kids, basically, or they want to use these social exclusionary forces to keep African American families from benefiting from services, and those can have really dire consequences for communities. So yeah, there are difficult conversations to have. I think my identity helps in drawing those things out, in part because I play up parts of it, and then some people just want to talk.
Yeah. Do we have other questions that folks want to ask? Oh, well, I guess not. We'll give people some time back in their day. Carol, thank you, Sarah.
Sorry, there were a couple questions in the chat. I just didn't want you to miss.
Oh, I don't see them. Oh, bizarre. Okay, but thank you, Sarah.
I can read them.
Why don't you read one? You read Becca's, and then I'll tee up them.
You found them?
Yeah, okay. But go ahead. I don't know why that did pop up.
So Becca said, super interesting. Have you thought about or researched the role of women of the landed white elite? I'm thinking of the wealthy wives who run local foundations and church programs, and the role they play in further restricting services to the deserving poor. If the public social service system is starved of resources, low-income people may be forced to go to churches and private social services agencies that have fewer fairness guidelines. This likely gives them even more ability to limit services to the deserving poor, while also feeling superior for their largesse.
That's a really great question. I think along with racism, there is the patriarchy in these communities as well. So it's really a lot of white men, actually. But as many of you probably do know, in the literature, there's not a lot of, there's kind of a dearth of nonprofit service delivery in rural communities. So there actually aren't a lot of options for folks in these counties. And the progressive element of the county is actually the Black church. So if there are opportunities for resources for low-income families, it's usually delivered through African American churches. So they're really sort of filling in the gaps when the state has failed these families. So it's a really good observation. I don't hear a lot from white women in these counties who are running, nonprofit organizations to help the poor. It's they don't exist. The nonprofits don't necessarily exist, and if they are around, it's usually African American churches that are running them.
Great. And then Liz Duffy also asks, she says, you may have mentioned this, but has research been done comparing states with county level DS admin versus state level?
So there's been some work done on denial rates for SNAP, and whether there's a difference in county-led or county-run and state-run programs. And it comes down to local political culture. So they find that in conservative states and conservative counties, they're still denying people just as much as states that have state level or state-run programs. So there isn't a difference in denial rates, but the explanation is something's going on with the local political culture in these rural conservative counties. So there's still the black box there. There hasn't been a lot of work on performance. So denials and performance are different things. Denials are an agency decision on an application or a recertification. But performance, in terms of how long it took the agency to come to that decision to deny or approve your application, performance like error rates, instances of corrective action, those aren't the outcomes that are being explored, and the differences across states aren't being explored on those outcomes.
Right. And that just spurred a question for me. So was there, I won't say was there, I'll say, so when COVID happened and they had to shift their processes for, you know, applying for SNAP, say, or thus and such, do you think that that was fundamentally, so how do you think that will interact with provision of services?
Yeah, my big concern with COVID and the CARES Act and the policy waivers is that it basically, what, in my view, based on the conversations I've had with directors, is that it's kind of an unfunded mandate. So they changed fundamentally how you can access programs and made it a ton easier, but they didn't enhance the bureaucratic capacity to deliver those programs. So I was talking to counties that had itty bitty agencies, but, you know, had a 40% uptick in applications. How does that work? Right.
Yeah.
And interviewing workers, you know, they're doing all kinds of things to meet this growing demand, the demand for, you know, assistance programs, and then also adjusting to these major changes in how they're supposed to deliver services. So they're having to relearn their job and do twice as much work as they did before amidst the same budget constraints, right? And we lost Democrats in the General Assembly this go round. So I don't think that's going to change anytime soon. I've been interviewing folks that are families that are receiving benefits throughout COVID, and there are some really great things about it. Like the waivers are amazing in enhancing access. There's also these information costs to the waivers. Half the people we talked to didn't realize that that there are fundamental changes to the benefit programs they were on, which says workers are strapped for time and they're not communicating, right? The state agency isn't communicating effectively what's happened since COVID, but there's still like this incredible demand problem and great bureaucratic constraints. Like, can I even talk to a worker? Like, can I even talk to a worker now if I'm new to the welfare state and I have to apply for SNAP, for example, for the first time? Those problems are still very much an issue.
And do you think that they differ across, like, I'm just thinking of the case of unemployment insurance, right? Which is often thought of as, you know, is a social welfare benefit, but is often thought of as differently than, say, food stamps or Medicaid. So I'm just curious if you've done if you've talked across types of agencies or.
So I haven't done any work with unemployment insurance, and oddly enough, it doesn't come up. It comes up sometimes in the interviews, like people's difficulty in accessing unemployment insurance.
Right.
I haven't done that. I haven't interviewed workers in UI or clients that are receiving UI. So.
Okay. Well, great. I'm not seeing, are there any additional questions?
No questions? I don't know if that's a good thing or a bad thing.
I think, well, I don't know either, but I do want to thank you. I really appreciated hearing about your work. We look forward to it progressing. We look forward to progressing and hope to hear more. Wait, there's a hand, and I have to figure out where the hand is from. Hold on. This is, I can't, who is raising? Melody, is that your hand? Okay, Melody has a question, so I will allow Melody to talk. There you go, Melody.
Hi, Carolyn. Thank you for this very interesting presentation today. And I was curious to hear about how you think this persist in rural counties throughout the country, especially other rural southern communities. And then I know you said North Carolina is one of the 10 states that does administer or county administered as opposed to state administered. And I just had a general question about, are the majority of states that do county administration concentrated in the South? or are they scattered throughout the states?
So to answer your second question, they are not concentrated in the South. They're all over. I think New York's a county administered state. Minnesota is as well, Colorado, California, Virginia. So it's not concentrated in the South. In terms of the, I guess, conceptual range of some of the things that I presented today, I anticipate pieces of this theory being relevant for a lot of rural communities. So it may be that depending on the state, the landed elite don't control the purse strings of DSS, but they do have a lot of control over economic development, and they are shaping demand for services in ways that can shape the quality of social service delivery. So I still think that there's probably a good relationship between the concentration of economic and political resources in the hands of a few and uneven economic development within states in the South. So I anticipate parts of the framework working outside of North Carolina, even without that sort of decentralized piece. Does that make sense?
Melody, are you going to respond?
Oh, I have put it in a chat, but no, yes, that makes sense. Thank you.
Okay. And I think, is that Melody's comment in the Q&A? Oh, no, one more question from Nancy. That was a fascinating talk and such wonderful research. Thank you for sharing it with us. I'd be interested in hearing more about if, when, why, and how, if, when, why, and how you saw people, ideas, and resources circulating across your boxes, and what this means for opportunities for transformation of these hierarchies, including potentially the role of non-local boxes in these processes, such as the state, larger political processes, federal policies, etc.
So I didn't see a lot of, I guess the depressing part of the project is that I actually didn't see a lot of resources moving. Like I do think that this social order and this power structure is pretty entrenched. And I also noticed there's a bit of a resignation among the people that I talked to about the order. So I do think that in terms of, I think I mentioned this a second ago, in terms of the power of the landed elite in shaping bureaucratic outcomes, I think the state could work to centralize administrative funds. So if the county doesn't have control over how many workers are at DSS, if county commissioners don't control that, I think there's a way to disrupt that power link. I think population changes are important too. So where these counties are located matters. I didn't talk about that, but I get into that in the book, in parts of the book. But being located near a metropolitan area changes who comes and goes in the county. Are there demographic shifts that are happening around the county that might lead to some sort of change? I think a lot of the folks that I conducted interviews with, they simply said, well, such and such died. So it could be that members of this white landed elite are dying out, and time might yield some change. But currently, I don't see a lot of movement. I think there'd have to be major policy changes at the state level, and I think that there'd have to be some demographic shifts to disrupt this power.
Thank you. Nancy says thank you too. Any other questions? One more. Thank you so much for your talk. Everyone's thanking you. Thank you for being with us, Carolyn. Something I'm trying to think through is disrupting the power structure. You mentioned maybe moving to a state system. Do you know the history of North Carolina using a county-based system and possible motivations to move away from that?
They've always used a county-based system. So even before welfare reform, they used a county-based system. I think it goes hand in hand with the state's rights ethos, especially around major transformations in the welfare state. So I'm thinking the introduction of the New Deal, I'm thinking the war on poverty and welfare reform. So they've always devolved a lot of authority to counties. So I don't think there's an appetite for state for a centralized service delivery. Unfortunately, I do think that the feds could intervene with a different kind of cost sharing agreement. Now, I don't know how well that would go, by way of the state's response to something like that. But I do think if we just get the purse strings out of county government, we could see some changes for sure.
Or so no hope of changing county government. Who's in power in county? I mean, right? Like, I'm just curious. Like, allegedly, these are elected.
They are. They are elected. I think we could see. I guess
I know nothing about the rural North Carolina.
As county demographics change, I think we could see different elected officials.
Yeah, I mean, but is are there? I don't know how to. I'm out of my element here. Are there, like, how strong are, like, parties, right? Like Democratic, Republican. Do you know what I mean? Like, is there local functioning politics, or is it politics of personality, or did your book not even cover this? I don't know.
Right, it's a mix of political parties and personalities. And these families are typically tied to the Republican Party at the local level. So the counties that I've been sort of spent time in are majority Republican counties. But again, demographic change. North Carolina is changing as a state. We were almost purple, or not purple, blue. We're purplish this last election. So, I think some demographic changes might change county government. But I do think that this work is sort of speaking to the legacy. Like, I was surprised. I was surprised. And I like asked myself, I didn't ask the folks I was interviewing, but why don't people leave? If it's so bad, you wonder why don't people leave? But they're connected to the community as well. They have, family there, and there's definitely a fear of the unknown. I know what this is like. I don't know what Durham or the big cities like. So.
Well, great. Well, thank you very much for your time. We're delighted to have you with us for this short time. Look forward to another world in which we can actually meet you in person. And to everyone out there listening, thanks for joining us this semester, and we'll see you back in January.
Thank you.
Thank you, Carolyn.
Bye.
Bye-bye.